Good morning, future doctors. Today we have another review of key points. This time we are doing a video in topographic anatomy, and this is an introduction video to the beautiful course. I hope you enjoy this course, but going straight into the key points. The two objectives we have today is understanding what a general minor tray of surgical instruments looks like, and what are special surgical instruments. This is going to help you understand what instruments we use for what operation, and what instruments in particular are supposed to function as, and what groups they are classified into. So we have got two main classification of instruments, and these two classifications are as follows. You have special instruments, and you have general instruments. General instruments are instruments that you use for any other operation, which means that if you have to do a thoracotomy, you need a general instrument. If you're going to do an abdominal surgery, you need general instruments. If you're going to open and drain an abscess, you will need general instruments. Okay, these general instruments are further on divided into three parts, but we'll go on and discuss them soon. Special instruments. These are instruments that are used for particular operations, and they are needed in only such kinds of operations, and these include operations like a craniotomy, where you're going to need a hand drill in order to drill through the skull, which is a very hard, compact bone. Tracheostomy, you're going to need a tracheal retractor in this operation, because you need to place an external tube through the trachea in order for somebody to breathe. So this is going to require special instruments. A thoracotomy as well requires special instruments, and these instruments instruments like a rib retractor, which you won't be using in any other operation. So furthering on our general instruments, we have three good divisions. We have a division of instruments that will help in dissecting. These are instruments like a scalpel, which are going to need for dissecting. You also need a scissors for dissecting or opening, or incision, so to say. For you to cut, you need these instruments, and this is the first group of instruments under general instruments. And the third instrument you could use for cutting as well is known as a Bovie electrocoagulator. So electrocoagulator, we just put a Z over there, and co-artery. All right. The next group of instruments are instruments that are used for suturing or connecting tissue, as you would like to say. In these instruments, I will explain about them in the bottom. They're used basically for suturing. So if you have to connect skin after making an incision, you need these instruments in order to close up the skin. And then accessory instruments are instruments that we're going to use to help us suture, and to help us hold towels over a patient while we are operating. Or these will be also instruments that will help open the incision or wound, so that we could see what's deep in the abdomen, or so that we could see what's deep in the thorax if we are doing a thoracotomy. So with that being said, let me just explain about the instruments that are used for incision. Instruments that are used for incision are divided into three groups. I say the scissors, a scalpel, and electrocoagulator. So a scalpel, actually we should have letter L over there. Let me just correct that for you. 1 second. Let's just correct this over here. Let's correct this real quick. Okay, we have it. So this is going to be a scalpel. There's a difference between a scalpel and a scalpel. Alright. The scalpel is going to be used for making incisions, and incisions could be different kinds of incisions where you do not know what shape and form of incision you're going to need. You get this scalpel number 10. If you know what kind of incision you want to make and it is precise, you want it to be exact in every millimeter, you use number 15. And as you can see, this has got a hypoobtuse angle, very sharp end tip. This number 11 is used for opening up an abscess, you see, or a cyst which needs some draining. You use this for stabbing. So when you use this instrument, you just want to make one incision and everything is dripping. This is what we use this instrument for. This is what we use this instrument for. Basically incisions and as well as making an incisional wound. What about here? Here we have how to hold our beautiful scalpel, and we have to hold it in different ways for performing different manipulations. You hold it over here like a violin when you have to make a very swift cut. This is usually used when you have to make a cut of a suture. You hold it like a knife when you are cutting through hard tissue. You hold it over here like a dining knife when you have to make an incision that is precise. So you use your index finger for balance over here. Then you hold it over here like it's a pen or a pencil when you're making an incision. So when you're cutting through the skin for the first time, you use this kind of maneuver when holding the scalpel. Okay. Next instrument to talk about are the scissors. The scissors are very interesting because you can use these for blunt dissection as well as sharp dissection, which we'll talk about the beautiful Matzenbeck scissors. This scissors has got blunt tips. The tip over here is blunt. This is the mirror scissors. You can see this is the mirror scissors, but I'm just giving an explanation of the Matzenbeck because I couldn't find it and a beautiful image of it, but it's got a blunt tip. So what you do is that after you make an incision, yes, you make an incision of skin. This is the incision. You have a muscle beneath. This is your skin, right? You've made this incision. Okay, so now you get the scissors. Yes, this is the scissors, and you start making a blunt dissection by opening up further into the muscle without actually cutting, because the ends are blunt. As you are opening up the scissors, as you open it up, you cut through, then you close, you go deep, you open up again. When you open up again, you make these types of motion. It's going to lead to you going deeper and deeper into the skin or into the muscle. This is the Matzenbeck scissors. It's a very interesting scissors, and it is used for this manipulation. We'll talk about it when we'll be talking about appendicectomy. It is a very, very beautiful operation, and with this operation you need to perform dissection of muscle, and this dissection is very important. Next is the mirror scissors, which we just had a look on. This mirror scissors has got a sharp tip as well as sharp hands as well. So this instrument is a general surgery instrument. You use it basically for cutting tissue during an operation, soft or hard. You also use it for making blunt not blunt, but cutting off sutures as well. We have a bandage scissors over here. This bandage scissors is used, as you can guess, for cutting off bandage. We have a Stevenson tenectomy scissors. This Stevenson tenectomy scissors is used for making precise and fine cuts. And how do you hold the scissors? This is a very interesting question. Students usually make a mistake with holding a scissors. So this is how you hold your scissors. You basically place your thumb into one of the holes, and then you use the fourth finger to hold the other, using the index for balance and support. The other instruments we use for incision is the Bovie electrocalculatory, and this electrocautery is basically used in incisions where you expect a bleed, or you use it as well to stop a bleed because it's got coagulatory function. So you made this incision on skin, right? This is your skin, and you made a cut, right, with a scalpel number 10, so to say. And then now you use this Bovie's electrocoagulator to go deeper. Why are you using the Bovie electrocoagulator? Using the Bovie electrocoagulator because the Bovie electrocoagulator is going to help you in making sure that your incisions don't bleed. Okay, the next instruments we talk about are instruments that are used for suturing, but we've reached our 10 minutes limit, and I would love to end the video with just a summary of what we have gone through so far. So what we have gone through so far is the classification over here. We have general surgical instruments and special surgical instruments. Specials are used for specific operations. Generals are used for all operations. The generals are divided into three groups. We have dissecting instruments, where you have a scalpel, you have a scissors, and you have an electrocoagulator. So basically you have SSE. Whereas instruments that are used for suturing or connecting tissue are what we're going to discuss in the next short video. Alright guys, bye bye, and thanks so much for paying attention.